Hey guys, it's Dr. Greer. We've got another edition of Carpools and Cannulas tonight with Dr. Kat Gallus for Restore Plastic Surgery in San Diego. Ella is joining us today. Hi. Yeah. And let me see when Dr. Gallus pops on. There she is. I'll see if I can pull her on here. And if you hear Frozen in the background, it's because we're watching episode 2 right now. So, it'll be awesome.
Hi. Hey.
How are you?
I'm good. I just raced in.
I just realized that my AirPods are dead. So there we go. Hey, we have 2 kids. Hey, here's Ella.
She was making slime.
Oh, nice. You like making slime, don't you?
We could do an episode on that.
There we go. Let's bring your daughter to IG Live Day.
That's right. How to make the ingredients.
Yeah, I know there's borax, glue, something like that.
Mm-hmm. And then you can make it different colors and sparkles and scented.
Well, that sounds delightful. I mostly just pick it out of the carpet.
Yep. That's my favorite. My nephew, in fact, actually, my sister just joined, was over at my house. They were making slime. Yeah, remember you guys made slime? And did this. No, he was over here. I'm getting edited on my story. Did this with the slime, put it in his hair. While they were Googling how to get it out, he decided to take matter in his own hands and did one of these. So we had baby bangs.
Ella one time stretched this really big bubble and put it over her head.
And it worked out okay?
That was Wyatt.
Was that Wyatt?
Yeah.
Oh,
He
okay.
used to do it all the time.
Well, it was one of you kids. I do remember picking it out of hair for a while.
Ugh.
Good times.
He put it in his hair, and me and Laura, we were getting stuff to
She's
get it
telling
out.
the story.
And then he went upstairs, and I was like, Ryan! And then he came down, he's like, I cut my hair.
Took it into his own hands. So, anyway, behind the hair are ears, which I think is what we're going to talk about, right?
Yes. Oh,
So
I do want to see my new necklace, though, first. Recognize it?
Oh, nice. That's beautiful. I have mine. I need to put it on. I'm going to wear it to the retreat.
Mine just came last week, so I'm excited. I'll wear it to the retreat next week, too.
That's awesome. That is awesome. Okay, so I know you were talking about putting product in your ears, right? For the holes?
Yeah. Here. Oh, I'm turning Frozen down since my AirPods aren't working. Yeah, I put filler in them a couple weeks ago, and I love it because my earrings actually have support. Like, my ear holes aren't stretched, but my lobes lost volume, so my earrings just look saggy.
Mm-hmm. I guess some people do get like a crease right here, and that will help with that as well. So you feel like it just offers more support to your ear. How much volume are you adding in there? Like 0.1?
It was like 0.5 between the two. And honestly, I left my studs in so I could see when it was.
Oh, enough? Okay.
Yeah. So that worked.
So like maybe half a syringe. And you used which product?
Well, I like Restylane because it comes in a half cc. Ella, it comes in a half ml, which is perfect for that. I used RHA too because I had a sample syringe of that.
So just straight Resty and a half cc.
Yep.
Yeah, I think Lobella comes in half cc too, but I don't. That's pretty. Yeah. Might not hold up as well. Okay, cool. Yeah, that's a nice little trick. I do earlobe repairs, which I'm sure you do.
Tons of them, and it's always people always call. Like right away when they've torn the earlobe, like the next day, should you go to the ER? No, the ER is going to send you home. It's not really an emergency. Just let it heal and then we'll fix it.
Yep. I do see them. Yeah. So I've seen either the ripped through, the complete cleft, or I have older ladies where they've been wearing heavy earrings their whole life. And so now the hole is just stretched out. And it doesn't hold an earring anymore.
Yeah.
Either way, those are both repaired very similarly. You know, excise the defect and close.
Close up. Yep. Do you do the stretched earlobes at all? The gauge ones?
I do. Those are not as easy.
No, they're a little more tricky, but they're very satisfying.
Yes. So I've done those. Those are those plugs where people put the spacers in their ears for, I don't know, people who don't live in Southern California or else. They are very popular here. And it stretches out your earlobe, but if you decide to stop wearing them, then you still have this big gaping hole in your earlobe. Yeah.
Yep.
So there's a couple of ways to do it. I try to do it so that the incision is on the inside, like towards the inside of the ear instead of on the outside. But either way, it heals really well. And
it does.
So the thing about doing all of those procedures, how long do you tell people before they can re-pierce their ears?
I will re-pierce it 6 weeks.
Okay. And then do you pierce in office for people?
I do.
Oh, okay.
I do. We just have a gun that I inherited from the previous plastic surgeon. It's the Inverness system. You just call the company. The gun is like $18. And the great thing is it's not spring loaded. You just squeeze it.
Oh, nice.
So it's really, really nice because you can get it all lined up and then you just pour it a little pinch. I keep waiting for Ella. Ella, do you want to get your ears pierced? I'll pierce them for you. She does not.
Oh.
Yeah.
Well.
But yeah, and I pierce babies' ears too. It's really fun.
And then does it come with the earring on it or they bring their own starter earrings? How does that work?
We just keep cubic zirconia studs in stock, so they don't get to pick. They're all just the regular CZ studs that go with the Inverness. And then there's like a little bottle of saline solution that comes with it too.
Nice.
So,
yeah, I don't do it in my office. Just people haven't asked, but my older two, everybody had their ears pierced as a baby, but my older two have 3 piercings on each ear, courtesy of me. And I did a neighbor's kid the other day. I was like, just get the gun off Amazon and I'll do it. But those are one-shot deals. Yeah.
Oh, yeah. No, the Inverness is nice. It was weird though. We had 2 of them and I was going to pierce somebody's ears a couple weeks ago and we couldn't find either of them. Like, where did those go?
That's my office. We have like those little hand mirrors. There's 3 exam rooms, 2 other rooms. There's 8 mirrors. There's only 5 potential rooms, and you'll be in a room and there'll be none. And you're like,
no mirror.
Yeah. There's 3 of them in one room or in a drawer somewhere, always.
Yep.
So, yeah. So So I tell people 6 weeks too. Don't re-pierce because we just fixed it all up. The other, usually do this as an add-on with a different procedure, or you can do it during a facelift. But is the aging earlobe? So.
Yeah.
Where the
little earlobe tuck, they get big. They get big and floppy.
Yeah, and so that also is kind of easy to do so that it stays at, like, the incision is kind of built into the earlobe and not coming outside the edge of the ear.
Yeah.
That is also very satisfying. It's really, I mean, it's something that if you notice it for yourself personally, it probably drives you crazy, but most people aren't like, oh my gosh, your earlobes are saggy, you know, but it is a thing.
I feel like if more people paid attention to that, I'd be doing a lot more earlobe tucks.
Right? I should start paying attention to the celebrities and try and figure out who has one, right?
Probably all of them.
I know. No stone left unturned. So earlobe tucks. I think that's all I've got on the earlobe per se. I think, do you do otoplasty or?
I don't, we did literally not a single one when I was in residency.
Mm-hmm. Yeah, I didn't do very many, but I did do a lot of ear cartilage grafting. Like we didn't do, I did not personally do otoplasty very much because the summer was the time where the Children's Hospital did that. But I did a fair amount of microtia surgery, so rebuilding an ear for somebody who doesn't have one, which is way harder when you're building an ear from rib. And then we did a fair amount of stuff where we took cartilage from the ear for other types of reconstruction. So I felt pretty comfortable and then kind of decided on my technique for prominent ears. A good friend of mine's an ENT in the Navy, and we used to, compare notes and whatnot. So I like doing them. And now I do them under local in the office. I just saw one of my patients back today. Yeah. And they're adults for the most part. I know that's just the demographic I see, that it's really bothered them their whole life, and they want to get it done. So with most surgery, the hardest part is the recovery, taking it easy for 2 weeks. People don't like to hear that. And I have them wear a headband after the initial dressing comes off, and then have them wear that for at least 2 weeks around the clock.
For support, yeah.
While the swelling goes down, while the incisions stick around. I can talk about that more if you want.
Well, how about sleep? Do they have to avoid sleeping on their side? That seems
I just have them try to sit upright on a couple of pillows early on. Otherwise, there is a lot of swelling, and you can get. Sorry, my dog just came out from under the bed.
Okay, I'm touching my dog right now. He's on me.
I'm sure she'll come over in a minute. So yeah, things to know post-operatively. There is sometimes a bit of swelling. Sometimes the face can get swollen, which is alarming if you don't warn people. But mostly it's just confined to the ear. The most concerning thing is having fluid collection or blood collect in the ear.
Right.
Did you ever do any trauma repairs for ear stuff? I'm sure.
Yeah, and I did some cauliflower ears. I was gonna brush it. Okay. Yeah, and some hematoma drainages.
Yeah. So, all right. So I'll tell before I just hijack this otoplasty conversation. Oh, she took one of my slippers. Tell us what a cauliflower ear is. Damn it.
So if you ever look at martial arts or wrestlers, they have ears that look kind of lumpy like cauliflower. And what's happened is they get abraded on the mats, they get a hematoma. The hematoma causes the cartilage to warp and deform and form extra cartilage and calcifications, and then it gets permanently deformed.
Yeah, it's just all this extra calcified garbage in there, which is why you don't want to leave a hematoma in there. So the problem with the wrestlers and the boxing guys is that they just ignore it, like not a big deal.
Oh, yeah.
Most people will come in and this happened, can you fix it? And you just drained off the fluid and you solve the problem. So with otoplasty, I see people 24 hours later because the most critical thing is to make sure that they don't have a fluid collection somewhere that needs to be drained, because that can kind of mess up the whole recovery. And if that goes okay, then they're fine. So that's, and then I've taken care of some dog bite injuries and other injuries to the ear where you're just putting stuff back together. Skin cancers can often end up on the ears because, especially in men, they're exposed to the sun, the tops of the ear.
And then the chronic chondritis nodularis helicans, long name. But it's just, if you have a really prominent area of cartilage, it can get just irritated and tender and sore. And excising that and shaving the cartilage down can help that resolve.
What about, did you ever do excision of the little accessory cartilages that are sometimes here?
Once, maybe. Yeah, I don't see
I don't know why that was, when I was in the Navy, that was a common request. People would be like, my baby's otherwise perfect. This little thing needs to go. And I'm like, okay. So we would wait until they were at least 5 months of age so that they were safe for anesthesia. And then it literally is a very simple procedure. But since the baby, it has to be under anesthetic. Those are all the little ear nuances. When I look at someone with a prominent ear, you know this, even if you don't do ear surgery, but I usually break the ear into three sections. So the people who have a really stuck out ears, often it's a combination of the middle ear being that conchal bowl being just big. So that's pushing the ear away. And then everybody usually has what we call an anti-helical rim. So you've got the rim and then you have a contrasting rim inside. And if it's a face, then that also creates, you have a very nice rim.
Yeah. Thank you. This one's a little mushed on this side, but it's always
I know, mine are not perfect either when you start looking. They stick up a little, but whatever.
Well, actually, it's funny. When I met my husband, I had been rotating on plastics a lot and talking about ear anatomy, and I was like, he has perfect little ears. They're just perfect.
Those are things you can't correct if they're really small or if they're really large. I think you can do an ear reduction, but I don't know who does that. But small ears, you can't make them bigger. I have a friend that's a plastic surgeon, and he pointed it out himself. He says, I have really weirdly small ears. And I was like, what? And then I was like, you're right, you do. But again,
his glasses slide around?
No, they're just small for his head, which of course there's a size dimension, just like there's a standard for everything. But I was like, that's so odd and unnecessary. But so yeah, so if that anti-helical fold is gone, you can still be president of the United States. I like to point that out to people. I just have all kinds of traffic tonight. Former President Obama has very prominent ears.
Turn that down a little bit, dude. I know, but they look good on his head.
Right. They're the right size. So he
Right.
has that effacement of the anti-helical fold. So it's like there's no crease up there, and then a little bit of condylar hypertrophy. And then the last thing to look at is their earlobe. So some people will have earlobe hypertrophy, i.e. it's large. It's usually not large. It's usually just sticking out. And most people don't notice or complain of that. It's just if you correct the rest of the ear and you don't address that, now all of a sudden you have this weird lobe sticking out.
Although I have to tell you, my best friend from high school, his earlobes were the size of a quarter. Legit, just the size of a quarter. He would hold one up and we'd all be like, oh.
That's crazy. Well, there's that whole, I can't quote it all, but it's the whole like, do you have a detached earlobe or does it go right into your head? Yes, yours is attached.
Honestly, most of my time operating around the ears is doing facelifts.
Mm-hmm.
And I've moved from putting the incision right in the crease to just like a millimeter away. It actually fades better.
Oh, really? That's good to know.
Mm-hmm.
Yeah, I think that's, again, those are things nobody notices until it's not right. And so
right. Like if you see somebody's ears pulled down like this, it's called a pixie ear, and it just means there was too much tension on their facelift closure.
Right.
So things we learn.
Yeah. So that is a telltale sign of facelift, that little pixie ear. Yeah, so that's otoplasty in a nutshell. And then I usually do it under local, like I said, the incision's all through the back of the ear and heals pretty well.
Nice.
Then, yeah.
Do you do any abrading or just the stitches?
No, I've never. So yeah, the Mastardi sutures are the name for those sort of sutures. I've never abraded. There was a huge push to do that. So that means going in and scraping up the cartilage, right? And the idea is that if you scrape the cartilage, it will bend away from where you're scraping it. So you have to go in and then on the anterior surface of the ear, abrade the cartilage. And they have little oto abraders. I believe there's an actual tool for it. But I never did it. And I did mostly adults while I was in the Navy and never had anybody recur. I think if the Mastardi sutures are in there, then they're in there. And again, my ENT colleagues didn't do it either. So I think it's a little bit dependent on where you train, whether they do that or not.
Gotcha. So you just used what? Clear nylon and
Fluoro nylon for the Mastardis. I'll do a condylar resection if they need it.
Mm-hmm.
And then a Furness suture. Everybody got something named after them. So to tack the condylar bulb back to the mastoid process, and that helps set the ear back. And then a little, kind of hard to describe, but another setback and excision on the back for the lobe. And not everybody needs all the elements, but they do need usually some component. Some people just need one of those three maneuvers. Stella's asking what you can do for a cauliflower ear. I know she doesn't have one, but
those are fine. You just hide some incisions in the creases, elevate the skin, and then you just get to reshape the cartilage.
Shave it down, yeah, and then put it back down. Would you bolster that? I haven't done one of those in ages.
I would. When I used to do either skin cancer resections or I would take a cartilage graft for a nose reconstruction, I always just did Xeroform front and back with through and through stitches to hold it on for a week. Never had a hematoma.
Yeah, I think that, especially for a cauliflower ear, because it's probably pretty inflammatory and it's going to ooze a lot. And we're talking about a bolster where you put like gauze or cotton essentially on there and then suture it in place so it's applying pressure. Because the ear is hard to splint. You can't put it in a little cast.
Wyatt, what do you need? I am on Instagram, dude. Okay, well, come sit.
Oh, so I didn't know you had a cauliflower ear. But yes, a bolster's definitely must have for that procedure. Yeah.
Oh, I got a schnoodle. I got a 7-year-old who needs a haircut.
Oh, another guest appearance.
Yeah. The baby's upstairs sleeping.
Oh.
been flying that airplane.
And
all
Wyatt's
day.
been flying an airplane on my iPad all week. Out of the 4 of us with COVID, he feels totally fine. He just tested positive, so
That's because I'm doing stuff.
So when did you get COVID this last week then? Or
Yeah, so we went to Disney last week, and really early in the week I tested positive, but I felt pretty much fine until Friday, and then I kind of crashed and burned for a while. So when we got home, we tested. Wyatt, stop it. The dog is going to bite your face off, and I don't do face reconstruction anymore. Okay. And so we tested the kids. They all tested positive. So I took off the first part of this week. And my very understanding patients got rescheduled, but I'm going to go back Friday because I'm feeling better, and they'll go back Monday.
yeah, it's been
2-week vacation.
yeah, it's not really a vacation when you come back with COVID. How was Disney?
It was amazing. We hit 3 parks in one day because we're insane. We did well. So we got the VIP tour, which if you have not done this,
We did 13 rides.
13 rides. Are you sure it wasn't 14? I thought it was 14.
I thought it was 13.
Okay. Anyway,
You must be thinking we went on a rock and roller coaster.
Maybe. So they just like take you around to each ride, and you get the lightning line each time, and then they like pop you. They like just cut through this little gate in Magic Kingdom right off of Main Street. There's a parking lot back there. They throw you in their van. They've got car seats.
Oh, nice.
Drove us right over to where did we go next? Animal Kingdom.
Mm-hmm.
Hit the rides there, had lunch, and then we went over to Hollywood Studios and hit the Star Wars rides. It was amazing.
That's awesome. That's really fun.
And for Legoland, remember that?
Oh yeah, we did the tour for Legoland too, and they got to go on all the coasters like 2 times in a row, and I'm like popping more Dramamine.
Except for the seesaw one, that span.
Yeah, there was a back and forth spinning one. We did not do that.
Yes, because it was
I
like,
love
and
those
it was
rides,
going
but
up
I
and
can only
it
do
was
them a
seesaw,
little bit, and then I start to
and
get
down.
sick.
Okay.
Yeah,
I
then I tap out.
I'm afraid of heights. So if it's like like the little coasters at Legoland, fine. If we're talking like Thunder Mountain Railroad, okay. But Six Flags or Cedar Point, like I am not your girl. I don't want to be on that narrow track looking over 10 stories and trying to panic. The whole time I'm just like praying.
That's how my sister is. I don't mind. We have fun, but my sister's less adventurous than you. She doesn't even like the Ferris wheel. She's like white knuckles the whole thing.
I don't like the Ferris wheel. It's hot. It rocks. No, thank you.
Yes.
Hard pass.
Yeah.
Oh, and then my Ella, the first ride we do at Disney is Space Mountain because they're tall enough for the first time. And Ella's like, I want to sit in front. It does. Right. I was like, are you insane? I hate being in front. I don't want to be in front. So then in Legoland, they're like, Mom, sit in front with me. I'm like, oh,
no.
I'm trying to set a good example of not being terrified for my children.
That's awesome. Yeah, we have a lot of adventure. My kids were all like, as soon as they were tall enough, wanted to get on the ride. So it's pretty fun.
Yeah, no, not my thing. And then, dude, calm down. And then the virtual rides, like there's an Avatar ride where you're riding the Banshee thing, but it's all virtual on a screen. I just had to close my eyes.
And then there's the dinosaur Jeep ride. Yeah. Where it goes around.
Those
and,
I don't do well with. They're not scary.
Yeah.
And then there's us.
Okay. She can say it again. Those are all the ones I would have thrown up on, so I did not go on them.
And then the ride.
But they have immature vestibular systems, which is why they can do it.
Yeah, I have an old, crusty, calcified vestibular system.
My system is like, nope, it's not matching.
They're
not happening.
I do a somersault, and I feel like I'm going to throw up. Like, for legit somersault or, like, a back roll, like, I'm spinning. Which I think is pretty common, because when I Googled it, there are all these articles on how to cope with that if you're, like, doing martial arts.
Really?
Yeah. Wyatt, hold still, dude. Yeah. So it's like a thing.
That's even more sensitive than I am. That's crazy.
It's a skill. Wyatt, you need to sit still. You're moving everything. Knock it off. Okay. Thank you. I mean, I got car sick every time we went to the grocery store when I was a kid. I don't think my parents ever realized because I never threw up, but I was miserable.
I was definitely motion sick a lot, but not. I could do a somersault. I was capable of that. That's hilarious. All right. Well, what are we going to talk about next week? I know I wrote down a bunch of topics. Then I don't know where I put it.
Gosh.
Or not next week. Next week we're going to be in Arizona.
Yeah, next week we're going to be in Tucson. My kids just found out today I was leaving. I was like, I need a vacation after our vacation. I mean, I'm presenting at a medical conference.
Yeah.
Business trip. At a spa.
That's right. At a spa.
So
Too bad we
wait,
can't do it in the spa.
how much are those shoes? Are those shoes really $1,000 a pair?
I think they're like $800, but they're custom made for your feet. I don't know.
Yeah, there's an orthopedic surgeon who created a line of shoes. You're unraveling your shirt, my friend. And I wondered, I was like, those look fun, but I don't know if I'm up for like $800 shoes because they'll be beautiful and then I'll never wear them. I'm like,
right. They're supposed to be comfortable, but I don't know. We'll see. We'll have the opportunity to scope.
I'll definitely go check them out, but
maybe when we're hanging out in Arizona at the Women's Plastic Surgery Retreat / conference, I've tried to get rid of the retreat word, but that's okay. Then we can plan our next talk.
That would be fun. I think we'll have time to catch up at the ASPS. That was hectic.
Yes. Yes. Yeah. Or DM either of us and let us know what you want to hear about.
Yeah.
Or if you have more questions about ears.
Cool. And we'll get to it in a couple weeks.
That's right. We'll have a good evening.
You too. I'll see you next week.
All right. Bye.
Bye.